any questions, please.
Hi, I'm Mark Michaels, and among other things, I chair a group of regional CEOs of multinational companies, many of whom are involved in trying to work with some of the markets that you were describing. And so it was very useful, and we talk about these issues too, and we haven't solved them either. But, you know, from a company's perspective, you can't generalize. But they too see the older group as potentially valuable group for the present and for their future. They do spend a lot in many different areas. They do save, but they do spend a lot in different areas. And so they may have to alter their products and services. At the same time, they've seen that. But key to that is what you were talking about, Professor, is feeling secure. And that's the part that isn't working, I don't think, so well yet. Whereas in a sense, healthcare, housing, other areas that, you know, that people have to feel secure before they go out and spend. It's not the case in China. In your very last slide, you showed the health coverage, but there was a small word there called hukou, which is an important one in China. And you know, that's one of the areas they're trying to reform, especially when people move. You really see there being progress, both of you actually. These are really tough public policy issues, as we all know. And we all know it's part of their plans. But you see evidence of real progress being made in those areas. There certainly is the intention. There certainly is, they articulate them, but you see evidence so far.
I think progress is slow on the hukou reform.
Yeah.
I think there are many well-intentioned people at the various high levels of different ministries in China that would like to achieve kind of a hukou-less society. So hukou, by the way, is kind of the official registration category for Chinese citizens, and it says you're an urban person or you're a rural person, and the entitlements are very different if you're one or the other. They often announce reforms that then kind of never really get implemented. I think they probably need to create systems that kind of go beyond hukou, so to equalize the treatment of urban and rural before they can just abolish hukou. It won't work in that the other way, the way around, where you say, because it puts too much pressure. If an urban city has to deal with all these rural people and they have new entitlements all at once, then they basically say, we can't afford it, we don't want to do it. And then they tell the central government. So either the central government has to buy everyone off and say, don't worry, we'll cover it, and then cover it, or they need to do it more gradually so that the actual benefits are very similar. And so then once the benefit levels kind of become more similar, then it's easier to integrate.
It's a public policy.
Yeah, it's a huge policy problem in two respects. Pensions are out of control in some areas and deeply underfunded elsewhere. So, for example, in Brazil, the emerging market, and even in the United States, civil servants sometimes and blue-collar workers for multinationals from the 60s and 70s have absurdly generous pensions. Washington, D.C., where I work, you have a lot of people who retired from the military at 45, retired from a corporate job at 60, and then they're still working as consultants while also drawing 2 pensions from their previous jobs. So they're great, they're golden. You have people who are defrauding pension systems. There was a case in Southern California of people who were voting themselves pensions of double their salaries because there were not enough people paying attention to what electors were doing. Illinois and Chicago are nearly bankrupt now. But Brazil had huge problems because for a poor country, they had very early retirement age, 50 for civil servants, and very generous pensions. So we need some rationalization. What Albert pointed out is right. It's absurd to think of retirement as something that you should go from 100% full-time work to 0% work. And that's how we've defined retirement. It's like getting to the end of a race and then you get rewarded for finishing. We need to think of retirement as a phased period of changing your workload, changing your tasks, changing your rewards, but working it out so you can still be as productive as you want to be, as you need to be, but also we need to pay attention to some of the double dipping, the super early retirement. You can't take it away from people who have got it. It's vested. But for the future, we need to train people to think about retirement as something that should be comfortable and should be secure, but not necessarily gold-plated, unless they save for it. Now, developing countries are doing better, but if they learn from us, they're not going to get it right. So I think we're responsible. And the other, one last thing is, when you're working in developing countries, it's really important for companies working in developing countries to invest in education, particularly secondary education. That's what makes the workforce of the future more productive. And a lot of countries that are not doing this well on their own could really benefit from public-private partnerships to improve delivery of education.
Yes. Especially vocational education.
I guess in relation to underfunding of pensions and public-private partnerships and infrastructure, the world at the moment is sort of, everybody wants everything now, and long-term infrastructure investments just, the emerging markets need a lot more infrastructure, which is actually 20 years. But how do you get people incentivised to invest in long-term infrastructure projects when everybody wants to return today?
I'm not sure I have a good answer to that question. I think politics tend to crystallize around urgent issues, and so unless you have very far-sighted politicians, these investments need to maybe will not get made until bridges start collapsing or people view it as suddenly an urgent thing. So you definitely have to take advantage of political moments that provide opportunity to generate more coalesced political support for these kinds of investments and programs. I think in places like Hong Kong too, the spending needs for the elderly is going to be a huge issue because Hong Kong, I didn't put up the numbers for Hong Kong, but Hong Kong is also hitting a point where aging is going to be increasing very, very fast from already a high level, but to a really, really high level in 15 or 20 years. And I think the politics are going to really change. And because Hong Kong, there's such a norm of limiting tax revenue and limiting government role, there's going to be a tension about how, if we do have to maintain a certain minimum standard of well-being for the elderly, what is the government's responsibility in that, and how much taxes we have to raise or increase to collect that, and can we do that politically in the current climate? So I think that will be challenging.
Aside from the amount of infrastructure, given aging, we're going to have to change the way we think about provision of infrastructure. We tend to think of infrastructure, schools, highways, bridges, metro, but with a population where 1/3 of all adults will be over 60, we need to think of infrastructure more in terms of making things accessible to people who have difficulty moving around. Do you have enough assistance to help people? Is the private market going to provide sufficient nursing care? Or is the state going to have to take a role? Sometimes you can convert disused schools to elderly centers. But even is the city sufficiently friendly for an elderly population, or do you have to think about incentivizing people who are retiring to move into communities designed for an older population in greenfield areas? So it's a big public policy shift. I think that's true, but you do have private enterprise building turnkey elderly community retirement communities for Americans in Costa Rica, Panama. It's a big real estate development industry for private sector. Private hospital chains are looking at ways to profit from government provision of medical services by coming in and being better deliverers. So there is a mix of private as well as public.
And even the Hong Kong government, I've heard that in one of my earlier talks on aging China, someone came up to me and said they're helping to coordinate a big experimental project in some of the reclaimed land in Zhuhai in mainland China, but it's going to be allocated for use by Hong Kong, and they're planning to develop an elderly-focused community system, and they're inviting private hospitals to come in and partner, etc. So
Golf courses.
I don't know about that, but so there may be some opportunities.
Last week I was in a small city, about 6 hours from Sunshine, listening to the radio while on the bus. That was a good news. Since the local village remind the elderly of 65 and above to update their registration on receiving a pension, which is about 150 RMB. It seems a universal plan on these tests. But I have the other side of it, which I like Professor Park. The current China National Security and Pension Plan has a big gap in liability and asset. The gap is pretty big. If you are in that area, you know the number, and what would be your thinking on that in, say, 10 years, 15 years from now?
Yeah, I've heard about those numbers. They surprise me a bit because the current elderly population is not very large, and it's going to increase. So if they're already having a liability asset gap now, you know, what's going to happen in the future? So I'm not sure what's driving that. I mean, partly it may be that there's an under-enrollment problem, especially for migrant workers. For the younger people, that would be the revenue source. And there's certain groups of the elderly who have very generous pensions, and they've been increased with inflation. You know, for the very older workers, they have 80% replacement rates, so very generous. And maybe that helps explain part of it. But it also
they expanded coverage fairly suddenly without having built up provisions.
Right, but then the other thing is how the funds are managed. I mean, there's a big discussion in China about whether funds you raise, because you should be saving, obviously, to cover the future costs. Can you put those into what? Typically, they're now just all put in government bonds, earning very, very low rates of return. And if you can put them into equity markets and earn higher rates of return, that's going to make the whole system more sound. But then, who makes those investments? Are there government agencies that know how to make them? There are many capacity issues, I think, that make these types of choices even more challenging. The 150 renminbi per person for older people in Guangdong is not very much money, actually. In rural areas in Gansu, where I've been spending time earlier this year, in one of the poorest parts of China, the benefit is 60 renminbi per month, right? And that's all nationally funded. So that's the minimum in China now. I think you'll claim. And today's old people, really, it's just a subsidy because they didn't pay into the system. Right? It's just a program. But if you add all that up, it's still not very much money given the amounts of revenue the government of China is now able to collect. So I think it's okay to be generous to today's elderly, even if there are gaps. It's gaps that are certainly gaps they can handle given the assets of the government. But it's really about the future, right? Because when you have the big bulge of elderly becoming very, very old, if you haven't come up with a financing scheme that's sustainable, you're going to have very difficult choices. You're going to either have to substantially cut benefits for old people, which is really going to impact their well-being, or you're going to have to think of ways to divert government revenues or raise new revenues to meet these needs. And so that's really the test. And I think I'm very sanguine about the prospects. I think it'll be very challenging. Maybe one. And how many questions are left? Okay, maybe one last question and then we'll close.
You mentioned that a lot of developed countries got problem with their pensions and a lot of developing countries are going there. But are there any examples of countries that have done this well or succeed in solving this?
I think that there are some interesting examples in Latin America. I think Chile and Mexico has proposed a new program, and you saw, I think Indonesia, where they're moving more towards a guaranteed social pension program. This is what I had mentioned in my talk briefly. That's kind of a new thing in social insurance policy reforms. The traditional model of pensions goes all the way back to Bismarck in Germany, who kind of established that it's all driven through employers. Employers basically, all the benefits go through your employers. And the idea of a social pension is that it doesn't matter if you're working, not working, a housewife, a farmer, you're going to get this pension, everyone. And even the workers who are working full-time and have a nice private pension program, they're going to also get this social pension. Right? It's going to be universal. And the reason that's good is that if you give it to some people but not other people, then now suddenly this is affecting people's choice about whether they're going to work in a big firm or work as a farmer, right? So if you provide social pensions just to the informal sector, it actually gives a boost to the informal sector, and it makes it hard for you to develop your formal sector, right? So you should give a flat benefit to everybody, and that way it's completely non-distorting and it provides a safety net. And then on top of that, allow employers to provide additional private, basically, tailored programs that they work out with their employees. But in terms of the government role, they should really be caring about just a minimum level coverage. And of course, in places like China, in addition to that, what's basically become a social pension in rural areas, they also have other poverty assistance programs. So if you're still poor, even if you're not old, if you're poor, you can also qualify for a subsidy as an additional safety net program. So between those things, hopefully you attain at least a certain degree of security that, as been mentioned, everybody really cares about. But I don't think there is a obvious successful. I think it's just a difficult kind of program.
Chile is the model for a country that got out of the government obligation by converting all of the pensions to mandatory saving with a rate of return equal to growth of GDP. So everybody was kind of given a base, and then the government got out of the provision business. They just now are collecting and managing funds. And that's basically liberated Chile from worrying about pension obligations in the future. But it's a rare exception because it took a small country, it took a lot of will. Where other countries have been successful is in linking the age of retirement automatically to life expectancy. There's a volume by Richard Jackson called the Retirement Preparedness Index you can find online, where he kind of grades all countries according to how well are they prepared for the mounting future burden of retirement. You can identify those who are more or less successful in his work. It's Richard Jackson.
Okay. So on that note, let me close our event and thank you, the audience, and the speakers, and all the organizers.